Welcome back to Rural Health News, the segment of Rural Health Today where we fill you in on the latest in rural health headlines. Today, it's a little bit of a different news update. I want to start by thanking the Michigan legislature for the hard work that they put into crafting and negotiating a very supportive budget for healthcare. Now, when the original budget came out, I would say 2 months ago, there was extensive cuts to Medicaid to the tune of about $3.4 billion, in fact. Our association, the Michigan Hospital Association, along with partners from every hospital across the state of Michigan, lobbied against these harmful cuts. It took months of negotiations. It took months of conversations, testifying, and other backroom conversations with our elected officials to explain to them the importance of maintaining healthcare in rural communities that prompted what I believe was the budget deal that we have today in the state of Michigan. Now, I'd be remiss if I did not thank the legislative leaders who made this possible. The compromises that were made between both parties was very important for bipartisan support. And then to the governor, Governor Whitmer, who signed this piece of legislation. I will declare that it's a victory for rural healthcare, in part because it does not dismantle programs that we are accustomed to serve our communities, our rural poor communities, programs that range from our obstetrics program for OB utilization, as well as the stabilization funds for other programs, looking at the uplift for Michigan Medicaid, ensuring that we do not enact the federal legislation any sooner than we have to. That was at play during this legislation. Very, very proud of the work that our team has been engaged in at MHA, as well as a very thankful and congratulatory praise that we would like to give to Representative Wirtz, as well as Speaker Tate and others who step forward to ensure that hospitals like ours continue to operate for their rural communities. You know, and in the conversation, the course of the conversation, the second approach was really how do we ensure that the sustainability of hospitals are secured. And through this legislation, they have enabled several pieces of legislation in which would help stabilize rural healthcare into the future. And we'll talk more about that for programs that range from OB centering to other important programs for SNF and other opportunities for communities like Hillsdale to be able to sustain in very tumultuous times. So first, thank you to the state government for the work that they've put into balancing this budget, proposing it, and not shutting our state government down. Now, I wish that I could say the same for the federal government. Unfortunately, the federal government finds themselves in a government shutdown, and really it's going to be a partisan battle for many issues. Some issues that are, of course, at play right now are relative to health care. The issue of a repeal on Obamacare, the Affordable Care Act, the repeal of certain provisions within the ACA, as well as looking at other funding reductions for Medicaid, such as reducing the percentage of provider tax so that hospitals like Hillsdale would be significantly impacted and cut by those decisions. Now, the One Big Beautiful Bill did produce that document, and that legislation is really going to cripple rural hospitals like ours by 2032. And as a result of that, Democrats have risen to say we don't want those cuts to Medicaid. And we are witnessing right now a partisan division in our federal government. And that has led to a certain extent to some of the disagreements that has resulted in the stalemate between both parties. Now, we would just say, we need to get the government back working. We need to make sure that hospitals like ours are getting their reimbursement for taking care of patients that are on Medicare or Medicaid, and to ensure that those hospitals are sustainable into the future. It's more about getting individuals back to work to be able to process those claims. And then other programs that we benefit from, looking at the employee retention credit, ERCs, other federal payments that come through to the state, but they have to be sent from the federal government. When federal government's on shutdown, all of us suffer. And hospitals that are rural hospitals with very few days cash on hand, in other words, not enough money in the bank to float a loan to themselves to get by, many of them unable to make payroll, purchase life safety equipment. This is a very significant concern. So we would just encourage our federal leaders to come together, do what Michigan just did. Put aside some of those deep angers, the partisan ideology, and say, you know what is best for our country? What do we need to do to preserve healthcare in our country, to preserve rural hospitals like Hillsdale, and to restore into those communities a sense of healthcare equity? And those things are right now what are on the table in the discussions, and we're very hopeful that there will be a resolution very soon. Now, the reason for the different format is because today I really want to focus on one of the areas that's gaining a significant amount of attention. And it was contained within the federal legislation, and it is called the Rural Health Transformation Program. Now, many of you may have heard of it. The RHTP, it's called, that's the abbreviation for it, which set aside $50 billion. And of that $50 billion, it was to be split into two tranches, $25 billion divided by 5 years. So really, we're talking about $5 billion per year that is available right now across the country. This has to be across the country. It's not just for each state. And it's through a competitive process. So, what I want to talk to you about today is that process, because there's a lot of misinformation that's presented by even some congressional leaders talking about how this fund will help supplant or supplement the funding that we're losing under the provider tax, which is absolutely untrue. It is not truthful when they say that. This money cannot, and it has been stated by both President Trump and Director Oz, this money cannot be used for direct payments. It cannot be used to switch out that which they're cutting from us under the Medicaid program. There are certain provisions within the funding guidelines that we have to adhere to. And then it's an application process that Dr. Oz himself gets to review from every respective state. So, when the one big, beautiful bill was signed, it created that RHTP program. And for 5 years, $50 billion would be invested into rural healthcare. It's a great concept, great talking points for sure. When we first heard of it, and I say we as the Michigan Hospital Association, because I'm a Board of Trustee member, our president, Brian Peters, took swift and immediate action. He empowered an MHA board-appointed task force, and we were charged with creating recommendations. Remember, we're not in charge of the fund. The state it goes to every governor. The governor can choose to give it to whoever they want to give it to of that respective state. Our governor has chosen to let the Michigan Department of Health and Human Services create the application, identify the parameters. Now, you might ask, what are the stakes for Michigan? Well, more than 60% of Michigan counties are considered rural, and nearly 30 hospitals serve as the only point of care for miles. Every time one closes, an entire region loses not just its emergency room, not just a specialty, but its largest employer and a key part of what we would call a safety net. The Michigan Senate Fiscal Agency recently reported nearly 22% of Michigan counties are considered maternity deserts. Wow. No care whatsoever in those communities, 50, 60, 70, 80 miles away for maternity care. When seconds count, unfortunately, devastation can occur if there is no resource nearby for those moms. These dollars should not get lost in the bureaucracy or redirected to administrative projects. That's my favorite. Federal dollars are allocated, and then pretty soon, the time they get down to the state and down to the local level, there's been so many hands in the pot, so many bureaucratic behaviors that occur where individuals want to take administrative cost out of it, create projects, and it doesn't ever get into our hands. But yet all around us, the politicians are going to be screaming, we gave you all that money, right? You should have saved your hospital. Must be bad leadership. Must be bad presidents. Not the case at all. These are hardworking individuals in our rural hospitals, volunteer boards who are trying to make it work. It's not about hospitals will fail because of bad management. Hospitals will fail because of the direct result of what the federal government did in cutting provider taxes, in dismantling our healthcare system as we know it in rural communities. And this was a lifeline, but I'm not sure it's a lifeline right now. We've got to make sure that it is. It should go towards the people and places that make healthcare possible. Our workforce, our technology, and our providers. If we want to build a stronger, more equitable Michigan, and you can put your state in here as well, we must start by keeping care local, and that begins with investing in the hospitals that keep our communities alive. So there it is, folks. Your challenge, your opportunity. I would encourage you to reach out to your elected representative in both the United States Senate and the United States House of Representatives. It doesn't matter what state you're in. This funding is open to all states. It does not mean that it's going to come equitably to all of the states because it is an application process, and there's going to be, from what we understand, sole discretion by the director of CMS, Dr. Oz. We don't know necessarily of any scoring system that exists or any type of rhyme or reason that would go into that. So lift your voice. Let your voice be heard. Let your elected representative and senator know that you want these funds to be delivered to your community hospitals, and it needs to happen quickly.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.